Hi, my name is Nora Giese and I have a master's degree in advanced Oriental medicine. For my master's, I conducted a research project about the acupuncture treatment of endometriosis. Let's have a look at this research. So the main question is, why is this actually interesting and why is this actually important? So first of all, the prevalence of endometriosis is quite high. In the Western countries, 1 in 10 women suffer from endometriosis. The pain symptoms, which is a bundle of symptoms, are the main symptoms affecting the quality of life of the affected women. So that's why this research focuses on the acupuncture treatment of pain in women with endometriosis. Unfortunately, the treatment options in conventional medicine are limited due to the side effects of the hormonal treatment and the risks of surgery. Therefore, it is relevant that we think about further treatment options, and current research suggests that acupuncture can significantly improve pain symptoms in women with endometriosis. But the main problem is, how should we actually treat women? How should we actually apply the acupuncture treatment in women with endometriosis to reduce pain symptoms? There are no guidelines existent to answer this question. So the aim of my research project was to define how acupuncture could be used in the treatment of endometriosis-related pelvic pain. Therefore, I conducted 2 stages. First of all, I had a look at the current research. What did they do in research? And subsequently, I conducted a Delphi study to find out what expert acupuncturists are doing in clinical practices. Afterwards, I tried to synthesize the results. I don't want to go too deep in the systematized literature review because I applied a pretty rigorous study design using predefined inclusion and exclusion criteria, predefined search terms on DARE, the Cochrane Library, Medline, and AMED, and extracted the data according to the stricter criteria. For those of you who are not that familiar with the stricter criteria, they have been developed by McPherson et al. And are an official extension of the consult statement. And they define how acupuncture treatments should be reported in research so that other researchers and practitioners do really know what they did in research, so that the treatments are repeatable. Overall, I found 94 papers and included thereof 16 which reported on 29 unique studies and cases. The main problem was that, in summary, there was little information on treatment details, especially on those studies which have only reported in reviews. So the main problem was really that they did report on the effectiveness, but they did not report in detail what they really did to decrease pain symptoms. So what they did in detail. So in conclusion, it was impossible to identify treatment details based on the literature review. Therefore, I conducted an eDelphi study. For those of you who are not that familiar with a Delphi study design, a Delphi study is a survey over several rounds, in this case 3 rounds, with the aim to turn group consensus to turn individual opinion into group consensus. And the idea of using a Delphi technique is that group consensus is more valid than individual opinion, and is therefore able to produce more reliable results than other survey techniques. An eDelphi study simply is a Delphi study conducted by email. For the recruitment, I used purposeful sampling using predefined inclusion and exclusion criteria. In the first round, I asked the experts what treatment details they actually use in clinical practices. Then I took these statements, which I gained in round 1, and asked them in round 2 and 3 to which degree they agree with the statement. And therefore, for this level of agreement, I used a 7-point Likert scale. And consensus was predefined if at least 70% of the experts rated 5, 6, or 7 on this Likert scale. Additionally, I defined the strength of agreement using the median and interquartile ranges. Let's have a look at the results. Overall, I included 20 international expert acupuncturists with a self-reported expertise in Chinese medicine. And I was really lucky because I really included experts from all over the world, from the US, from China, Israel, the European countries, China, Korea. So this was really great. And quite a high level of expertise. So the experts reported as, or self-reported a mean number of 16.8 years in clinical practice. Overall, 94 statements were rated as relevant. On 29 statements, consensus against common use was found, and 55 statements did not reach consensus. Afterwards, I tried to synthesize the results, but the problem, as I said before, the problem was that I didn't have enough information from published research. So overall, or in conclusion, it was impossible to, or I found too little agreement, and because the results of the systematized literature review were just not valid enough. And therefore, we decided to still give recommendations for clinical practice, but to base them on the results of the eDelphi study only. Let's have a look at the results now. This is the centerpiece of this research. So how should you apply acupuncture in detail? The acupuncture style which you should consider using are either TCM style, Mastertung style, electroacupuncture, or a combination of various styles. The treatment should be fully or partly individualized. The characters in brackets indicates the strength of agreement, meaning A as a strong agreement and B a moderate agreement, which have been gained in the eDelphi process. There are a range of acupuncture points which you should consider using, either with a strong agreement or with moderate agreement. The further details of needling are a bit tricky because most of these further details of needling should be applied individualized, meaning that they should be determined by the individual patient or the individual point or the specific situation in which you apply this acupuncture treatment. So what we do now are that points on the abdomen and back should usually be used bilaterally, that the needle retention time should be about 30 minutes and that you should use disposable medical stainless steel needles. The further details of needling are, we will talk about this in a bit, they need to be defined, or the determining factors for individualization still needs to be defined. The treatment frequency should be once or twice a week for a minimum of 2 to 3 months until pain is relieved. So this is really important because it matters that there is a minimum period of time of 2 to 3 months. It is not enough to apply acupuncture 2 times a day for 2 weeks or something. So the period of time is relevant for effectiveness. Other components of treatment include Chinese herbal medicine, heat, either as moxibustion or as using the heating or TDP lamp, giving dietary advice, counsel regarding lifestyle and stress, yoga, qigong breathing exercises, and mindfulness. Beyond the stricter criteria, I found a huge number of statements which goes beyond the stricter criteria. And I cannot summarize all of them, but the most important ones. So endometriosis is caused by an abnormal movement of qi and blood in the uterus. The treatment should not be reduced to blood stasis, which is always a branch, but should treat the base root as well. Therefore, it is essential to treat throughout the whole menstrual cycle and not just before menstruation and ovulation, or through menstruation. So it is really important to treat throughout the whole menstrual cycle, to treat the base root as well. The treatment should be evolved according to the menstrual cycle and adapted to comorbidities such as infertility. If heat improves the pain, heat should be used even if the tongue shows signs of heat. Very interesting. A combination of local and distant points should be used. The treatment should, as I said before, should be given throughout the whole menstrual cycle, but the frequency can be increased around menstruation and ovulation in severe cases. So the treatment should also aim to help the patient to achieve emotional balance. and patients need to stop smoking and avoid getting cold. The participants of my eDelphi study, and this is really relevant, identified 2 key factors for effectiveness. This is, first of all, the additional use of Chinese herbal medicine, and secondly, giving dietary recommendations. A range of acupuncture treatment details are not recommended for common use, meaning that these details have been rated as or have found consensus against common use. That does not mean you cannot use or should not use these details, because some of the experts stated them in the first round that they use these details, but not commonly. So maybe you should keep these details in mind for recalcitrant presentations. This includes scalp acupuncture, a range of acupuncture points, and a range of additional components of treatment like enemas with herbal decoction or vaginal steaming. So what can we do with these results of this research? So the aim was to define how acupuncture should be used. So overall, it is all about guidelines, how we can guide clinical practice. Guidelines in conventional medicine are usually developed from systematic reviews and meta-analysis. So as we found that systematic reviews in acupuncture rarely report sufficient treatment details to inform guidelines. So the problem is that we do not have sufficient information from research from the top of the evidence hierarchy. However, as long as there is a lack of high-quality research from the top of the evidence hierarchy, it is good practice to explore treatment details based on the Delphi technique. In conclusion, we can provide acupuncture treatment details for use in clinical practice. However, these data provide no information about effectiveness per se, and so these good practice guidelines are preliminary. Future research needs to test the effectiveness of these provisional guidelines. And as I said before, we need to find out the constitutional factors for the individualized treatment aspects. My main point here for you as a take-home message is that you remember these points which the participants rated as key factors for effectiveness. So it is not enough only to apply acupuncture. It is essential that you also add the use of Chinese herbal medicine and that you also give dietary advice to your patients with endometriosis for the best of your patients and your practices. Thank you very much for listening.